Thank you both for coming. I'll have you formally introduce yourself in a second, but I'm really appreciative that you have joined me on this interesting and informative, hopefully, session.
Yes.
We're excited to be here.
So
Yeah.
before we get into introductions, I want to just let everybody know who's listening. First of all, thank you for joining us, and feel free. Somebody will look at the comments. I don't know. Liz has an eye, maybe an eye on the comments
Mhm.
on LinkedIn if there are any, but this is not intended to be an expert women's health session. We are not claiming to be experts, nor are we able to in any
I
way
think we're live. If we're
like
not,
describe or diagnose any conditions or treat. So I just want to let you know that the intention here is to be a sounding board, to let you know you're not alone, to let you hang with us as we chat over a roundtable for the next hour-ish, and basically give a voice to others who maybe didn't feel like they had one. So we're going to kind of go through our journeys. I'll also be including some statistics that are from peer-reviewed journals, and ultimately giving you some language and voice in your own journey if you are a woman and are on this journey, and or if you know somebody who is. So the goal is to spread the love. We aren't here to sell you anything. I have nothing to get like sell you at the end. I am going to share a tool with you that will be like just of interest at the end if you want to take a look at it for feedback purposes, but there is nothing to sell. There is no Stripe payment link. Nothing is happening at all during this talk. So with that being said, I will let's start with my amazing guests who have agreed to join me in this conversation. So, Alicia, can you please introduce yourself?
Hi, I'm Alicia Decker. What would you like me to introduce?
Just a snapshot of what you like, your background, your medical background, how you and I know each other, quick.
Okay. So Claudia and I went to pharmacy school together. I'm a pharmacist, just celebrated 23 years, as a pharmacist, recently, last in May. Um, and yeah, I am a medication safety pharmacist, and I have two kids and a husband, and I'm a female, so I'm on this journey of just questionable stuff at all times.
And you kind of paved the way for us. You started before you started the final last part of this journey before us. So you like kind of inspired me as well. So we will get to those details of the journey in a second. But Liz, can you introduce yourself as well?
Yes, Liz Dernan. Gosh, Claudia, you and I have known each other for 15 plus years. Everything that Claudia has done, I have just absolutely loved her work. It's at the core of what she does. It's always about helping people. She's very educated and her background being, having the pharmacy background. So she's very knowledgeable. She knows what she's doing. But more importantly, it's about the care that she has. And I think that energy has always resonated with me. So for me personally, I used to be a surgical tech. I thought it was something that I would love doing and quickly found out how broken the healthcare system is. I unfortunately saw a lot of things that were happening in the OR, that there were cover-ups. There were wrong site surgeries going on, a lot of things that I wasn't okay with morally, and I knew I could not have a career doing. So I got out of it. Then Claudia, you and I started actually working together when you started your patient advocacy company, and I just thought, man, this is great work. I'd love to be a part of it. The rest is history. I still advocate for better healthcare because, as both of you know, it's a nightmare, especially for women, unfortunately. And I'm just along for the journey. So I'm here with both of you right now, just talking about my experience, how we can make it better for everyone else.
I love it. I love that you two have joined me. I know there are many other stories that we have heard personally, and so we certainly are not the only ones, but I figured it would be a great start to have this roundtable to just start the conversation with people who want to hear it from accessible people, right? I know there's a lot of influencers on social media talking about similar topics, and that's fantastic. I love that there is this much conversation going on, but also it's sometimes nice to just know it from people that you know. So for those of you who are inner circle and like want to feel a little bit closer to the story, hopefully this will help you do that. So, all right, I think what we'll do is we'll sort of do it in three parts to our journey. So, like, what does the younger part of our cycles, menstrual cycles, and for anybody also, just FYI, we're gonna be like respectful, but also like this is life, right?
Yeah.
Like we're gonna say the word tampon. So if any of this is like not okay with you, or you're not here for that, just know that. But we will do it in a professional, respectful way. So the beginnings of our journey, so from the beginning of menses to teenage, young adulthood, and then we'll kind of move from there. And in between each section, I'll kind of break it up with some stats and interesting figures that should be shocking to everyone. So
Mhm.
is if that same order works, Alicia, I'll have you start just kind of with a like, storyboard version of what it looked like. What were some of the challenges you faced when that started for you?
So I thought I had a pretty normal start to womanhood at around age 13, got my first period. And I remember distinctly when I was in high school having to go to the clinic and be picked up from school at least once or twice a year because my cramps were so bad. I thought I was dying. Like I almost passed out. I was doubled over in pain. And I don't necessarily remember anything being done, just that it was intolerable. And bleeding through clothes, bleeding through pants, having the sweatshirt around, always having a sweatshirt or jacket with me because I always like bled through. That's just what it was to be a teenager, a,
Mhm.
a female, right? A teenage female. So when I was, we're just doing adolescence
Yeah,
or,
yeah,
yeah.
like
So
in
I just,
teenager, yeah.
that was my strongest memory. And now as I'm watching I have a 21 and an 18-year-old, and now when they complain about their cycles and how painful it is, I kind of validate to them what I experienced, and that hopefully it doesn't last like that forever. I don't remember when it went away that I was that much in pain. I don't know that it did. I think I just got used to it and learned how to treat the pain so that I could function. But I definitely missed days of school, specifically related to my cycle.
Hmm. Yeah, I mean, we're all shaking our heads, yes, in
Yeah.
solidarity. How about you, Liz?
For me, same thing. Probably around 13 is when I first started. And then I think when I was 16, I can distinctly remember going to the doctor because I had really bad cramps. It didn't seem normal. But of course, you always go to your family, right? So I have a sister, my mom, my aunts, whoever, all seemed to have similar issues, but they all dismissed me and said, oh, it's just, part of what you got to deal with. And it's just suck it up, essentially. So early on, I think at 16 is when I was given birth control from the start for specifically for cramping and to try to control what that was like for me. It only just got worse. I would keep trying to switch. Let's try something different. Pills upon pills were thrown at me, different suggestions like let's try the depot shot, let's try this, let's try that. Nothing ever seemed to work except for then that's when I got into a pretty big heavy usage of ibuprofen. So I was using, gosh, what was I doing? I think I was doing 800 milligrams every 4 hours, just around the clock to be able to function. Because, like Alicia said, I could not function day to day. There was just no way. I would miss school. I remember a time in college that I threw up because it was so bad. It just went on and on and on. And every single doctor I would go to, I think even when I was 16, I started to get cysts. And again, they would dismiss the cysts and say it was normal. We're not going to watch it. It's not the right size yet. So again, for years, I kept, oh, okay, well, I guess I'll just see you in another 2 years when my cramping is bad again. And oh, and there's another cyst again, but let's just keep going down the rabbit hole and no answers.
Mhm. Yeah, I feel all of that. I can definitely resonate with both of those. I started at 11, so I guess I won that game. I don't know what I get. No party prize there, but that just means I've been suffering for longer. So yay
Yeah.
me. And Yeah, like out of the gate, just horrible. I mean, just all of
Mhm.
what you guys both mentioned. Definitely horrible cramps. I was offered nothing in any doctor's offices. I think my family, also thought this was normal. They had all been told it was normal, so it was kind of like this is life. Sorry, but I can't take it away
Mhm.
from you. So, just let me know what we should pick up at the pharmacy, right? So,
Right.
sometimes
Yeah.
my mom would talk to the pharmacist and get ideas. Sometimes she would give me naproxen. Ultimately, I ended up having such bad headaches too, so I ended up on Excedrin and just completely abused Excedrin because it worked so
Mhm.
well for both headaches and cramps for me that I had no obviously healthcare education at that point, and nobody in my family was educated in healthcare, so I had no idea what the risks of overdoing it on Excedrin were, and I found that out later in life with gastritis and other GI symptoms. But I basically survived on Excedrin for many, many years, and not
Oh.
really in a great way. I do remember being given naproxen by at that time my husband now I was dating, like we were dating as early as 14, and his father was a physician, and so I remember being like in a fetal position at their house one day and I didn't have any meds and he gave me naproxen, and I just remember like thinking this was the most magical, what is this thing that you've given to me? And yeah, I mean, just completely debilitating from a functional standpoint. I mean, there was nothing I was going to be doing in any active way on at least the first, like, 3 days, because
Mhm.
of the heaviness of the bleeding and because of the symptomatic cramping and headaches. There was like no functionality. Um, I think I tried to push through for school, but certainly missed days as well. But
Mhm.
it was just the beginning of the dread of each cycle. Like it's coming again. Like it was just the train that was coming for me every month. And like how many, of course, we didn't have like phones and apps back then. So it was just like
Right.
looking at the calendar, and mostly it was predictable. So I could kind of guess, but it was just this dread of like, we're doing this again. So yeah, that was, I think our experiences are certainly similar there. I will, as we kind of go through, I'm going to share a few stats that I think are just important for people to know, because it's great for us to share our experiences, and it's also great for everybody to know that they're very much not alone. So,
I didn't know that secret about Excedrin. I wish I knew that.
no, I definitely do not recommend. I suffered for a long time after that. So, it is effective and it also is very damaging.
Yes.
Uh,
Yeah.
so just to throw out some stats that are from actual clinical and peer-reviewed journals, 75, and we will get to like actual diagnoses. So I know we're throwing in the word endometriosis right now, but 75% of endometriosis patients were misdiagnosed with the wrong condition, physical or mental, before ever getting the right one. So I don't know, we're all three of us suffering from endometriosis that young. I don't know, but it's actually possible because they are now diagnosing as young as 8 is the earliest I have recently heard. So it is possible. And that word was never brought up to me. Even to date of surgery was never brought up. I mean, obviously, as I grew in my medical knowledge, I knew the word, but that was never brought up to me as a potential until post-surgery. Um, so as far as further stats on dismissal, 40, so basically half of these patients were specifically told their pain was a mental issue, so anxiety, depression, stress instead of a physical one. I know I have definitely in appointments been told it might just be anxiety. I imagine all of us have. And then 76% of adolescent girls believed period pain was simply a normal part of the menstrual cycle. Only 15% ever sought treatment for it. So, I mean, this has been told generations, right? This is what's been told for many generations. So our parents wouldn't have known to tell us any different. Our doctors clearly didn't tell us any different. I think the conversation is shifting now, but very slowly. So, as Alicia mentioned, her daughters are, certainly of the age to be menstruating, and they're not like their doctors aren't necessarily telling them that pain is abnormal and something should be looked into. And so it's still very commonplace to just be told like this is what it is. And
Mhm.
so I think a theme that I want to have running through this is that common doesn't always equal normal. So something that is common can also be abnormal. And period pain is that? So this was actually interesting out of New Zealand that 4.6 versus 9 years. So patients who weren't dismissed by a clinician were diagnosed with endometriosis in 4.6 years, and patients who were dismissed waited nearly twice as long. So dismissal is obviously a huge thing, and there's huge impacts from dismissal. So I've got lots more fun
What do
numbers.
you think, Claudia, in your opinion, what do you think, and Alicia, this is for you too. Why is that? Why do you think it goes that long without anybody questioning, oh, why does this pain keep happening or why does it worsen? Is it because of diagnostics that it is so difficult and they don't want to just say, let's do surgery? What do you think?
I mean, I think in adolescence, I remember being given prescription naproxen. That was, now that we're talking about it, I
Mhm.
totally remember getting that
Yeah.
prescription. And there was never any diagnostics, and it was just a normal part of the process, of the experience. And even my 21-year-old, her pain is so bad that I brought her to a GYN where normally she wasn't, she's not, was not of age yet to go and need exams or anything. And even that was probably a year or two ago, and the GYN said, this is normal. We need to start ibuprofen 2 days before you're expected to get your cycle. There was no exam. There was no imaging or anything. This is just what it is. And so learning that it's not supposed to be like this is a
Mhm.
bit of a shock. And even as a medical professional, this this was never the pain associated with having your cycle is just what is normal, is what we're taught. So
Right. Right.
I don't, I think that the lack of diagnosis, I think the lack of accessible diagnostics that are make it easy and not invasive and not costly. And then also the fact that the pain being common, not being abnormal, not being seen as abnormal. I think this is, there's not, they don't think there's anything to diagnose.
Mhm.
Yeah.
Claudia, what do you think?
No, for sure. I mean, Alicia and I went to pharmacy school together, so we can say, at least from the pharmacy end, that I mean, all we are ever told is what pills to give people for their symptoms that they have. There is no
Right.
discussion about any of this. Now, obviously, we are not diagnosticians, and so the argument is in pharmacy school, that wouldn't be talked about. But I can assure you, it wasn't talked about in medical school years ago. Whether it's starting to be talked about now, I don't know, but it's not something that is trained and well enough for anybody to even have that conversation. And I mean, I'm hoping that that becomes more commonplace where physicians, family physicians, pediatricians start to question it and find the right specialist, because of course we can't expect a pediatrician to also be a specialist in something like endometriosis, but we certainly can expect them to not dismiss significant symptoms and to send for testing by the most, specialized physician that could diagnose. So, along the lines of testing, I'm learning all kinds of stuff too, because this was not on my radar. And there are actually, well, imaging can start to question at least adenomyosis. And we'll go through, for those of you listening, we'll go through the diagnostics when we get to our own diagnoses. But imaging can start to give an idea, or like ultrasounds, but it requires a very skilled physician radiologist to look at those to know. And so we're still lacking in that. And there are actually saliva tests, and very similar to like an EEG, there are pads that are now being placed on abdomens of women and not really happening in the US. They're not even really available in the US, but they're like now widespread use in like the UK. So that's really fantastic. So there are much less invasive options to start to get an idea of this. But right now, all we're left with is a physician who starts to question it and then offers an exploratory laparoscopy. I mean, basically
Right.
surgery to see it, which is insane that that's where we're at right now. With like, that's the only way we're going to know. But that's kind of
Mhm.
where we're at, which is, it's very sad. Okay, so let's go into sort of later life, not later life, but after that first part. So we're going into college years, we're going into more childbearing years, like, as you had your children, and then maybe shortly after. And then the third part will be, will be
Today, the current situation.
the hey, guess what we're diagnosed with?
Yes.
So
Yeah.
so take us through the next like decade or two, Alicia.
So I was put on birth control pills also probably around 16 or 17, literally just for the cramps and acne. And I don't remember having to go through a bunch of different ones. I maybe a couple, but um, so I was on birth control from before I was needed birth control, right? All the way through until I decided I wanted to start trying to have kids. And then, getting pregnant, it took us several months. So that we were very lucky in that we didn't have difficulty. And after my kids, it was just more of the same. I mean, the cramps were awful, and every month it was just awful. Uh, and what I noticed, and this gets I don't have a specific like cutoff of when things were bad because I did not know what I was experiencing was symptoms of a different problem. I thought it was so my first daughter was 8 pounds, 12 ounces. She was 11 days late. She did not want to come out. And both my labors were a bit traumatic, but with my first, she was pretty big. And ever since having both of them, I had issues with urine leakage. I mean, like I always had the sense of urgency, but as I got older, it just got worse. Um, where I felt like if I had to pee and there was any pressure change, I stepped off a curb, I sneezed, I laughed, any of that, there was going to be a problem. And I always would say to my kids, Haley, this is your fault because you're so big. I would joke with them, you're the reason that mommy can't laugh without peeing her pants. I couldn't do like exercise classes that involve jumping because I could do 1.5 jumping jacks before I would have to leave the class. And I always felt pressure in my lower abdomen that I assumed was just what we felt. It didn't, I didn't know it wasn't supposed to be there until it wasn't there anymore. And so that was that was just what adulthood has been. And post kids and uh, pre-intervention, that's basically my story.
Yeah.
Jeez,
Yeah.
that's
How about
wild.
you, Liz?
Well, so like I mentioned, I just got pills thrown at me all the time, and I was good about taking them. And there's always that you hear that old wives' tale about, oh, if you've been on birth control since you're 16, you're gonna have so many problems trying to get pregnant. Well, that was not the case. Once I got off birth control, and we went to start a family, I mean, Billy would just look at me and I'd be pregnant. So we had no problem at all. Got pregnant. Then after I had my daughters, it seemed like I was getting a lot of really big clots. And then by that point, with two young daughters, they're only 18 months apart. I couldn't remember to take a freaking pill. So I went to my doctor and I said, I'm having a really hard time. I'm getting these clots. They're really painful, really uncomfortable, but I cannot remember to take my birth control. So what are my options? So again, the depot shot got introduced. Oh, you could take it, but it could affect your mental health. No, I'm not doing that. Or you could try patches. And I didn't think any, are you familiar with these patches? Okay. I didn't think it would work. I thought it was a bunch of hocus pocus. Like, sure, I'll give it a try, but I doubt this will do anything. Sure enough, it worked. It worked for probably a year, maybe. And then I started to have the same issues. So no matter what I tried, I would always go back to the same issue where, oh, they would tell me, skip the placebo, just keep going. Then I'd have the breakthrough bleeding, and it would always come back. So after the patches, after I felt like, I don't know if you both felt the same way, but I know for me, I felt like I had to just try everything under the sun until I could finally raise my hand and say, can we please do exploratory surgery or something that is not, let's poke around and see if you have endometriosis. I had that fun issue going on where for like the fifth or sixth or 10th time that I had gone in for an ultrasound for a cyst, they told me, oh, well, we can actually try and do this test where when we're in there, we can like probe you and see if there's movement on ultrasound. And I was like, wow, that sounds like so much fun. And at the time, I had a cyst that was the same size as my ovary. So this woman does this poking, and I'm like being peeled off the ceiling. And of course, oh, sorry, like, did that hurt? Like, of course it hurt. You can see how large the cyst is, and yes, that hurt. But did it confirm endometriosis? No, it did not. They still were of the mindset that it's just, I don't know, women have cysts, they come and go, it's not that big a deal. And then it wasn't until, I don't know, like the 20th round of doctors that I had seen where the surgeon made a comment about, women get cysts every month and it's no big deal. You should not be feeling them. So the fact that you're feeling them and you're having them burst, I was getting to the point of they would burst. And, I'm driving down the road with my daughters and I'm just like grinning and bearing and holding on for dear life because it would be bursting and it was so uncomfortable. And I would just think, I just need to get home. I just need to lay down. That was the point that I was at, that I just knew this is not normal. I cannot carry on every single month where I'm going to wonder how big is the cyst going to be this time, or calling Billy and saying, come get me. I can't move right now. Like I can't do anything. That's where I was at with all that.
Hmm.
It's awful.
Yeah. Well, and it's interesting because you two have very different details, but the fact that whatever you were experiencing was normalized, like this is just
Oh,
another thing
yeah.
we're all dealing with, is obviously the running pattern and theme. So yeah, I mean, I continued on with the pain and really heavy bleeding. I always had to use like ultra tampons. I mean, like there was no wear a small pad or wear a like regular that was like not in my vocabulary at all. I had to find the largest potential option that there was, and that was the only way that I could function in life for, the heavy days. The cramping was just ongoing and debilitating. I was also offered birth control, which is the ongoing theme, and that's still what's being offered. I think I took it for like, I don't know, a year. I didn't love being on it, so I wanted to get
Mhm.
off of it. After I had my son, well, and it's funny because, during pregnancy, I mean, honestly, outside of being able to feel him kick when that actually started happening, not having my period was like the best thing ever.
Amazing. Yeah.
Like I'm like everybody's like, yeah, I love, telling me all the amazing things about pregnancy. And I'm like, I mean, I'm not loving most of this, but because I was very nauseous but I was like having a break from that was absolute heaven. So
Mhm.
I do remember just like, and then, after I had him, I was quick to look for options that would be equivalent to a birth control. I didn't want to take a pill, but I was very quickly talked into an IUD. So I had Mirena for 5 years or 6 years. And
Oh,
and and that was, effectively glorious because I was kind of continuing my non-bleeding, non-cycle years. And so that was great until I, learned more about the risks of IUD and really just didn't love having a, foreign object inside of me. And so I opted to remove it. And my, gyne was shocked and, she was like, everybody's got one. She had one. Like, we're all just doing IUDs now. And I'm like, I just, you know, as we've all, kind of grown in wisdom and gotten older, you just start listening to your body more inherently, as intentionally, and but also just sometimes it talks to you when you don't know, not necessarily, thinking it's going to. But I was like, no, I can't have this. Like, it's got to come out. I mean, this can't be natural. This can't be right. And
Mhm.
not to say anything bad for anybody who's listening who has an IUD. Like I said, it was glorious, but I also knew that over time there were going to be more risks with it. It was also relatively early on the market then, so I knew we didn't have as many years of post-marketing surveillance, and so I just didn't feel really great about it. So I had that taken out. I was not one of the lucky ones who just like didn't have a cycle then for many months. It was immediate, like the raging train. It was ready to come back, and so I
Oh,
just stepped right back into all of the horrors of the debilitating pain. And I had moved away from Excedrin at that point because I had such bad gastritis from the aspirin and Excedrin. And so I was now basically living on around the clock naproxen with Prilosec to protect my stomach. And so now we're just adding meds to
Mhm.
add to the side effects of another med. And so that's basically how I lived for, however many years up until recent, which we'll get to the more recent in a second. But now it's time for more stats because who doesn't want to know what
Yes,
terrible things are going on?
I love a good stat.
Okay. Um, all right. So what's normalized? So 35% of girls, which I'm actually shocked some of these numbers are lower than I would have expected. 35% of girls and women told period pain was simply normal and it kept many from ever seeking care. 25% were told heavy bleeding was normal too, despite it being a red flag for fibroids and other treatable conditions. And up to 40% of people who menstruate miss work or school because of period pain, costing an average of 9 days of lost productivity a year, which we've talked about that. All of us have had either missed days of school and work or both. But I think, this heavy bleeding conversation is important because people don't know, like women don't know what heavy bleeding is because nobody's quantifying it. Occasionally, a gyne will be good about that and actually ask like what, how many times are you changing your, pads or tampons, but also, if you're using an ultra tampon and changing every hour, that's a lot different from, like a panty, like a light pad, and you're changing that every hour. So there's really not a lot of conversation that goes into detail to quantify what that is. But abnormal, just for those listening, so I can help you quantify, abnormal uterine bleeding is actually in and of itself an indication for a hysterectomy. Not that you have to have a hysterectomy, but for any of you who are suffering, heavy bleeding is over. Well, it's changing your pad or tampon, which they don't quantify the size of those, more than every hour, but also it's over 5 tablespoons of blood during the entirety of your cycle. There's no chance I was not well over that. Like nobody even told me that number, and I'm sure I met that on day two alone. Um,
Man, that's
so
awful.
so just so people know, because people like, what is heavy bleeding? I don't know. Like, how much do I bleed versus you bleed? Like, we're not all sitting in circles talking about this. We are now here, but I mean, in general, like, I didn't sit around with my friends talking about this. So, and if we're not talking about it in our doctor's offices, then where are we talking about it?
Well, no, because then that'd give us justifiable cause, right? To go ask and question, hey, this isn't normal. Oh, you have a number for it. Oh, okay.
Mhm.
They
Yeah.
wouldn't give us that information. No way.
Yeah, and it also requires us to be very self-aware and paying attention to this because obviously we're not collecting our
No,
blood and we don't
no.
know if it's 5 tablespoons, but we also know what a tablespoon looks like and we would know to say yes, my guesstimate is over that. So just so everybody knows kind of where we're at with that. All right, so we're now at 6:33. Okay, so now we'll kind of get to how we all ended up with surgery, what surgery ended up showing us, and just some more insights for what people can do, how they can have these conversations with their doctors. And we certainly are not, as we talk about our procedures, we are not suggesting everybody needs to go have the procedures that we've had or that we are somehow superior because we made them all happen. But we're opening up conversation so that you all have the verbiage, understand what's going on, and can at least open the door to conversation if you want to. If you are in a good place and you don't want to, this is not certainly not telling you you should. So, okay, Alicia, start us with all the fun stuff you found.
So, yeah, in my, I would say in the last 5 to 10 years, my cycle started to become very irregular. I would bleed every 2 weeks for about 3 to 4 months, usually over the summer, ironically. And I went to my OB, the same OB that had delivered both my kids, and I went one summer and I'm like, I mean, we're going on like 6 periods in 3 months. And I was bleeding like it was every 14 days. And I went and he said, okay, we'll send you for an ultrasound. Got the ultrasound, you have cysts. And he would say, okay, you have ovarian cysts. They're either your body will take care of them or they're going to rupture or whatever. And we could do nothing. We could do a DNC. And I was like, I'm not going to do a DNC just to do, like, I'll just deal with it. It's just annoying. And the next summer went back, forgot that I had done the exact same, like totally forgot because it resolved itself like he said it would. And then it happened again. Same thing, 4 months, every 2 weeks, like clockwork, which is very inconvenient because if you bleed every 2 weeks for 5 to 7 days, you're basically bleeding most of the time.
Hmm.
Bled through pants at work. I mean, that was the one of the hardest things was the fact that I never knew when my period was coming, and I had to leave work at least twice because I'm an adult, and bleeding through your pants at work is not I'm not in high school anymore. Like I can't stay at work. Super embarrassing. I have to go ask my boss to leave because I have uh, can't like I can't predict my period. So I went back, got the same ultrasound, found the same results, offered the DNC, offered to put me on pills. No, we're not doing that. Okay. Then my OB retired. I went to a new OB and we started this over again. And I let them know like this is what has been found. And um, we did he did a hysteroscopy with an endometrial biopsy. I 0 out of 5 stars. Do not recommend. It's a lot of pain to make sure that there was nothing malignant. And then he was saying your options are IUD. There was never, other than ovarian cysts, anything ever told to me. Then GYN ended up moving on to a different type of specialty practice, and I'm with a female GYN, and I tell her the situation. So she sends me to ultrasound again, and the ultrasound tech was like, "Wow, you have a really big fibroid," and I'm like, "That's new. I didn't know that." And I still also had the cysts, and so when going back to the GYN to discuss the results, she's like, okay, here's our choices. We either do nothing, IUD to get you through, because I'm still at this point bleeding every 2 weeks, or not, or yeah, like completely random. Um, and she said, you can, okay, DNC, I don't remember if she said DNC, but she said, we can put you on the pill. We can give you an IUD to get you through menopause so that you just don't bleed through menopause. Or I can send you to a surgeon and we can talk about surgical options. I'm like, send me to the surgeon. I'm kind of done with this. Like, I'm done. The house is closed. I don't need this. I'm done. And so I went to the surgeon, and even after all of I told him about the feeling of pressure. I told the other GYN too about the feeling of pressure. When he asked me the questions, I'm like, well, yeah, I do have abdominal pressure. I do have like feel like I'm could pee my pants at any time. I felt like I had to pee all the time. And it wasn't like because I had so much water and I'm emptying so much out of my bladder. I just felt this urgency and this frequency and whatever. So my first option that he gave me was not even a hysterectomy. And I'm thinking, just let me do the hysterectomy. And he offered to do an ablation of the fibroid. Again, just these band-aid fixes. And I said, like, can we just talk about a hysterectomy? Like, I don't have a need to hold on to this stuff. I would just rather have it out. So we ended up scheduling the hysterectomy. And do you want me to go all the way through that, Claudia?
Yeah, yeah,
You?
yeah.
Okay, so did the
Whoever's watching is
hysterectomy,
waiting for the punchline, Alicia.
right? I will tell you that I had to redo that hysteroscopy with endometrial biopsy. I was very displeased with. I was like, wait, while it's still in, because I would like you to do that after it's not attached to
Oh,
me anymore, because
yeah.
that was very traumatic. There is no like anesthesia given. There's no I think got a Valium that I could take at home, and I brought my husband to hold my hand, but it's painful. This is what we have to go through. And I actually was pulling up because after the hysterectomy, I read the surgical report and found out that um, I can't remember the size of the fibroid, but my uterus was a 15-week uterus. Not sure. I was shocked.
Mm.
It was, I had an ovarian cyst that they took care of, but the fact that the fibroid was that sizable and that my uterus had that much, he even had sent me to a urogynecologist because of the urinary symptoms. And they were like, okay, pelvic floor PT, you have bladder and uterine prolapse, like, but nobody said anything about the fact that my uterus was gigantic. Like I was in my second trimester of having of whatever. And there was other adenomyosis. There was no malignancy. Praise God. They took my everything but my ovaries. And there was pathology in there that I didn't know that wasn't even discussed. I read my operative report when I went for my follow-up. There was no like, oh, let's review. Hey, here's validation as to why you felt those symptoms. And since having that, it's now been my surgery was in October, and I enjoyed my 6 weeks of recovery, of just kind of healing and letting my body do what it needed to do. No more urinary urgency, no more pressure. Not surprisingly, with that size of a uterus, that I would not, that I had pressure all the time. I can like do a jumping jack and not pee my pants, and I don't pee all day long. I have not gone back to do pelvic floor PT because I think everything's fixed. But it amazed me at how easy the recovery was. The surgery was, the first couple of days was uncomfortable, but it fixed so much. And I had things found. I think Claudia, when we were talking, that I had, was it endometriosis and like endometrial?
Yeah. So you had adenomyosis, but then you had endosalpingosis, which I actually had never heard of. So we were just learning all kinds of things together. So basically, the
Yeah,
fallopian tube tissue can grow outside of the fallopian tube. I
that's what
didn't
it
even.
was.
So
Oh
you
my
had that,
gosh.
and that wasn't even discussed to you. We were just recently looking at your diagnosis.
I sent her mine because she sent me hers, and I'm like, wait, I don't even look at this term. I was so the uterus that was over a pound was when it's supposed to be like 6 centimeters or something insane, and mine was just. I was so taken aback by those dimensions that I did not even pay attention to the other stuff. But what validation to find out that all of what I was experiencing was completely explainable. I just had to press 4 different GYNs to listen and to actually like, could we please just do this? Otherwise,
Right.
I'd be running to the bathroom right now because I would.
Didn't you have countless ultrasounds where they take, because I know
Oh,
every
I
ultrasound
did
I have.
look, yes, and I did go back after my I was told by the female uh GYN that I had a fibroid. I went back to the prior ultrasound, which was less than 2 years prior, and it said there was a small fibroid, but it was never told to me. No one ever mentioned it to me. All that was ever talked about was the ovarian cysts that would just resolve, and nobody mentioned fibroid because I would have remembered that.
But they
And
never measured your uterus, just like in a regular routine ultrasound?
nothing that they may have. I didn't go back and look, but it was never discussion. It was always to
Yeah.
rule out that there was something that was causing these symptoms, but they always called it you're bleeding because of the ovarian cysts. There was never another explanation. And there was the only thing to do about it was IUD, birth control. There was never a like a definitive answer, or maybe it's time to consider surgical intervention.
Oh my gosh.
Yeah. So that's my story. I that hysterectomy was the best thing that's ever happened to me. I mean, so much of my body feels better. And I feel like I suffered for a really long time with things that weren't necessary to suffer through. And I avoided hormones. I didn't want to take more hormones. I didn't want to have something else added when we didn't have a root cause as to why the bleed. Like I don't want to hide the bleeding until I don't need to bleed anymore. I'd rather just figure
Right.
out what the issues are. And that the birth control and IUD would not have fixed the other things, which were really even more impactful in my life, which was the constant feeling of pressure and pain, as if I had a 15-week uterus pressing on things. That's
I can't
there's
believe
no
there were
cutting now.
countless, it sounds to me like there were countless opportunities to catch that, and nobody did, obviously.
It did seem that way. It seemed that this was just normal in the perimenopause ovarian cyst world, um,
Right.
that you just bleed all the time and hope for the best.
Gosh, that's awful. Well, I'm glad you got relief.
Yeah, best decision
100%.
ever.
Yeah. I mean,
Um,
like new lease on life for sure. All right, Liz, what you got?
my, once I had my daughters, it seemed like I started having irregular cycles as well, where I would start bleeding every 3 weeks. The duration between cycles would shorten, and then the heaviness was increasing, the clots were getting worse, everything was getting so much worse. What was really becoming the most debilitating, in my opinion, aside from those things, is I would start to, it seemed like the cramping never went away. It was all the time. It was in between cycles. I wouldn't have to be menstruating to have cramping. And then I started having lower backache that was just constant and so achy, just putting me in a bad mood. It didn't seem like anything could help it. I don't take ibuprofen anymore unless I absolutely have to for GI issues or for GI reasons. So I just kept on, I guess I'll just keep pushing through this pain. And once I realized that I had to be done with that pain. And my left ovarian pain is what I was always having. My right one was never an issue. It was always my left. I was having these cysts every single time I go for ultrasound. It was just that one. So during my pre-op appointment, I had discussed with my surgeon, if there's a cyst, could you remove it? And he said, oh yeah, sure, no problem. Like if there's a cyst there, I could definitely remove it. So I said, okay, great, that sounds good. We'll just go with that. Because I was thinking that maybe I wanted to remove my left ovary, but I was like, I was kind of on the fence. He convinced me to not remove it because his opinion was, well, you're still young. Like, are you done having kids? Yes, I'm done having kids. Okay, well, heaven forbid that so many years down the road you haven't hit menopause yet. If your other one takes a dump for whatever reason, then you're going to be on hormone replacement therapy. So I decided, yeah, I guess you're right. Like it makes sense. But it was the absolute last appointment before surgery, which they rescheduled. My surgery was an admin nightmare. Every appointment got rescheduled. Nothing ever made sense. Billing, like everyone was calling me. I never got told about these phone calls I had to be available for anesthesia. And it was this whole thing. It was such a circus. But the day before my surgery, I met with a PA. That was my official pre-op appointment. And I had told her, hey, listen, I think I've decided I actually want to have my ovary removed. So she's like, okay, yeah, no problem. We just need to make an addendum and we can definitely do that for you and change your surgical plan. So then we're going through the decision of what's the judgment call. So are you saying you absolutely want it removed, or is there like a if-then statement? Like, well, if there's a cyst, if it looks questionable, yes, remove it. And she said, well, we can't actually remove a cyst because they bleed so much, but what we can do is drain it. And I was thinking in my head, like, wait, so there's confusion around my surgeon telling me he can remove it, and you're telling me you can only drain it? So then I just thought, okay, like we'll just forget it. Like addendum, your judgment call, we'll go with that. And then the day of my surgery, which was the next day, I just told the surgeon, listen, could you just take it out? I don't want to deal with this anymore. Even just the admin side alone, just scheduling the surgery was a nightmare. I don't want to deal with this anymore. Like, let's just get my let's get my money's worth, right? So I go in there. My surgical plan was that I would have 3 incisions. I woke up with 5. They still haven't explained to me why I have 5, and I had my post-op appointment today. Um, it was an exploratory surgery that confirmed endometriosis. I had cysts in my ovary that looked like they were luteal, so it looked like they were just normally occurring cycle issues. I had cysts in my fallopian tube. My fallopian tube was twisted. None of this was explained to my husband when I got out of surgery by the surgeon. And then even today, when I was talking to my surgeon, who is actually urogynecology, I explained to him, like, he said, how was your pain? Like, what's going on? And I told him immediately after surgery, immediately after, my back pain went away. I couldn't explain why. Like, I don't know why that was the case, but like the night before the surgery, I was having cramping, I was having my lower backache, and post-op, I had just had immediate relief. He's like, oh, okay, yeah, that's great. Just like over here typing his notes, not paying attention. So then I take it a step further and I let him know, like, yeah, I used to have really bad pain. Like, let's say I didn't go to the bathroom, I didn't have to void in the middle of the night. I wake up the next morning to relieve my very full bladder. I would get so much pain. I don't know why, but I would get so much pain before the surgery. But after the surgery, that pain is gone. I used to have issues with bowel movements not being very regular. That's fine now because I have this relief. For whatever reason, whatever was happening on the left side of my ovary, something was happening, but my surgeon did not care. All he cared about was, okay, I did my job. You're fine. You're feeling better. Get out of my office. But all these other things that were happening and that were resulting because of the surgery that I was getting relief from, he did not care. And so I left that office and he had told me, okay, well, you can resume seeing your regular GYN. And if you need me for anything else, I'll be here. It's like, what?
No, thank you.
Okay. Yeah. It's
I'm
like,
here.
yeah, like, okay, that's great, but man, do I feel so much better. And I'm so glad that I elected to have my ovary removed when none of you ever suggested it. And then he treated my endometriosis like he had discovered that I had high cholesterol. Like, oh, here's just another one. Didn't talk about the long-term plan, what are we thinking? Do we need to consider anything else, like removal of any, do you need to get rid of your uterus? Whatever. None of that was a conversation in that exam room.
Wow.
That was my experience.
Yeah, there's so many things to say, like all the things I want to say. Well, I've said them all to you guys. For sake of time, I will go quickly through mine. So I actually was not offered surgery. I had to fight tooth and nail. Like after Alicia had her surgery and I saw how fantastic life was, I was jelly to no end. Okay. Like I don't want I can't be having this anymore. And Alicia came with me on my Italian retreat that I hosted. When on our flight out, I started my cycle, which could not have been any worse timing. But I was like, there's no way. I have to be done with this. So I have lived in the area that I'm currently living in for 4 years, and I've been through three OB-GYNs, and none of the first two, like the first two, there was no conversation even really allowed about any of this. Like I honestly, I think I gaslit myself because I was so like I had really started to believe that all of my complaining was exactly that. It was just, and I wasn't really complaining. I was just stating matter of fact in appointments, like this is what it is, like my bleeding cannot be normal. It just like it can't. It was just worsening over time too. Like the last several years, it was like to the point. I mean, I could leave the house, but I had to be really careful where I was going and how long I was going to be there. And so about 7-ish years ago, my previous guy had offered me tranexamic acid, which, if anybody's listening, is a very great right now fix. It does nothing to fix the problem, but if you are having excessive bleeding and you need a break from that until you get this figured out, it was a complete lifesaver for me. And so I really appreciate that. But the fact that anybody needs to prescribe that should already, the fact that it exists and is being prescribed like just another naproxen should be in question. I'm so thankful for it. So I'm not blaming that person at all. But I think when that's getting prescribed, other conversations should be happening. Like, why do you need this? This maybe isn't normal. But in any case, so that helped me with my bleeding. And I was like, this is not sustainable. Like, I should not have to be taking like blood clotting pills, naproxen, Prilosec. Like, I was using TENS units on my, like, heating pads. Just this cannot be life. And I don't know how much longer I'm going to be dealing with this. So I would joke for like years with my husband, like, he's an anesthesiologist, like, hey, can't you just like figure out how to make this happen for me? Obviously, I know he can't, he doesn't have the power to like, slip me in after hours, but I kind of was like somebody needs to make this happen. And so my second to last gyne was like, okay, well, here's what we'll do. We'll do another ultrasound, and then, oh, we see a polyp. Okay, we're gonna go in there and so DNC the polyp. And I was like, okay, fine. Maybe the polyp is the entirety of the problem. Like this one polyp, right, could really cause this much problems. So whatever. She took the polyp out. I went through the whole thing. Zero change. Like right back to awful. And what I was offered at the follow-up appointment with her was the IUD, 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 IUD. And I'm like, I'm not doing an IUD. I would really like a hysterectomy. And she just looked at me, I mean, without actively laughing. I mean, it was might as well have been laughing. Like, that's not going to happen. Basically, because nobody seemed to think I had enough of a problem that would be a codable diagnosis for a hysterectomy. Now, of course, I know a whole lot better than that because just abnormal uterine bleeding is sufficient. So, long story short, to wrap this up, I ended up finding a guy with my husband's help who would actually give me a hysterectomy. And so I'm like 3.5 weeks out from it. Very much like you two, life is, outside of the recovery, which is hard for a type A personality, life is so much better. It can't even be described. Like, you don't even know how much you're suffering until you're not suffering because you don't know what
Mhm.
is like completely don't know what's normal. If you've been suffering since you're like 11, 13, 16, whatever, like there is no understanding of how your body can be without that. And so I am just so eternally grateful that I had that. My diagnoses were lengthy and lots of bullet points. I sent them to both Alicia and Liz, but I had endometriosis that never even crossed my own mind because I was normalizing my own pain after so many years of everybody else normalizing it. I had
Mhm.
adenomyosis, so I had both, which is fun. And then I had leiomyomata, which is just a fancy word to say fibroids. I had multiple fibroids. That wasn't None of this was seen. Like they literally scraped my uterus. None of this was seen, or even suggested. And you know, and I also had cervicitis. So I also had cervicitis, which means inflammation of the cervix that has since been removed. But my hypothesis on that, because I've never had an infectious cause, I've never even been tested positive for HPV, is the tampons that I was using. To be honest, I really think that is of course, that will never be discussed with me. Nobody cares. It's out now. It doesn't. Nobody cares, but I care. I care for other women, right?
Yeah.
So I'm pretty confident that that's what caused that. And none of that, like just the litany of diagnoses. And I'm looking at this like I'm blown away because this was a difficult to justify surgery. And now it is like, could not have any more justification. Like I literally had everything you guys had. I didn't have the ovarian cyst and I didn't have endosalpingosis. So I guess there's that. But I basically had everything else you can have that is benign. Thank God that we all had benign
Yeah.
diagnoses.
Mhm.
But the point here is that I had to fight for surgery. Alicia was finally offered surgery after many years, and Liz also fight for surgery. And there are now physicians who are being vocal about the fact that we should be allowed to have these discussions with physicians for an organ that we no longer need. It doesn't mean that it should be pushed on women. If you don't want, obviously, if you don't want to have something like this done, you shouldn't have it done. It should, though, be an option for those of us who are done with having children. This organ does not need to be there. Obviously, we need to keep our pelvic floor strengthened so we don't have prolapse. We understand the risks of that organ now not being there, but my life is already eternally better. And so we are just here to share that with all of you. Let me share some more stats and some social media stories. So the average time from first symptoms to an endometriosis diagnosis is 8 years and 10 months, which, obviously for all of us here, it's decades, but I guess that's the average. Um, this is actually this is actually out of New Zealand also, but so for the point is for some populations, this is much lengthier. Obviously, we know that because we all went decades, but the point is this can very much go decades. 80% of Black women and 70% of white women will develop fibroids by the age of 50, often with more severe symptoms and later diagnosis. These are huge numbers. So this is the point, is common does not mean normal. Like this is extremely common. What, 8 out of 10, 7 out of 10? That's insane. Um,
Right.
the average time women wait to seek fibroid treatment is 3.6 years. I mean, obviously, well, I didn't even know I had them. And just to mention, to kind of piggyback on Alicia's 15-week uterus. So I then learned that a normal uterus is like 50 to 60 grams. Mine was 121, and Alicia's was like 520 or something. Like Alicia's was that big. And like full term uterus in the third trimester is like 1,000 grams. So Alicia was like half of that. And so we're all just walking around with these huge uteri. Uh, let's see, 40 to 60% of the roughly 479,000 hysterectomies performed each year are done because of fibroids. And here's some just interesting stats regarding other conditions we know are widely tested for and diagnosed. So 10%, this is the current stats, but there's no way that this is underreported. This is not underreported. 10% of reproductive age women live with endometriosis versus 11% of adults live with diabetes. There's no chance that every single one of us and those who are listening and everyone else beyond has not been tested for their blood sugar. And so the fact that these numbers are basically the same is completely nuts. And the funding difference is 29 million versus 311 million. So that's nuts. And I also want to point out that we already talked about common does not equal normal. This is actually taken from social media recently, like people commenting, and so these are their stories. Endo and adeno self-diagnosed in nursing school. It took 7 doctors gaslighting me before one finally ran the test. I was stage 4 by the time I was properly seen, which just means it was like infiltrating organs. Diagnosed with endo in 2023 after 15 years of asking. It still rules my life every day. 26 years to diagnose after being gaslit every time I brought up a female problem. No pain is the baseline, which is important to know. Like pain is not normal. This was actually comments on a post. So a woman was actually talking about the fact that she uses ultra tampons and changes them 5 times an hour, which is like
It's
well
crazy.
beyond what I was dealing with, and I was bad. And so I said, I hear you and validate this completely. I mentioned the potential for these. I also mentioned in the comment about the potential for tranexamic acid prescription in the meantime. And the important point here was what she said. Thank you. Seriously, the only progress I've ever made with my chronic illness has come from suggestions from strangers on the internet. So her inner health circle is people commenting. Like this is where we're at. So the point is, you're not the problem. The system is. Oh, and I want to share one more. We're like 2 minutes over. I want to share one more. This was a really impactful story too. And I know this is kind of small, but oops. So the woman who posted it said, nothing says women's health care quite like bleeding heavily for 2 weeks, passing clots, intense cramping, and leaving your appointment with a heating pad recommendation. And one of the comments was, couldn't have an IUD or take birth control, got 3 opinions, ended up in the ER on Christmas because that's exactly where I wanted to be instead of with my kids. Hemoglobin was at 5, which, for those of you who don't know, like normal is, 12, 13,
But
14.
it's not, yeah,
Uh,
that's
3 bags of blood and 3 bags of iron later. They sent me home with 6 blown veins. My uterus weighed 5 pounds.
holy.
Like Alicia's
Wow.
was what, a pound? Alicia's
Mine
was
was
about was
like over a pound, yeah, but
okay, so 5 times the size of Alicia's, which was already 15 weeks. I had my period every other week for 4 years. The amount of
preach.
pain I was in, no man could ever, nor would ever be able to handle. Okay, we're not man bashing here, but I'm just saying, like, these are the story, and they're endless. I'm just showing you the few that I came across because now my feed is apparently all endometriosis. But um,
That's
the last thing I want to share is if anybody's listening now or on the replay, I have um, I am really trying to be a part of the solution. I am not a physician. I obviously cannot diagnose anybody. So we are not claiming to be women's health experts. So in my lane, what can I do? So I've already been working on the beta form of this Navigator, which is an AI app. And I have, since all of this, informed it and guided it on how to guide women on talking to their doctors about women's health problems. This is actually probably going to I might need to log in since it's been a while. So as I'm logging in, the reason that I'm showing you is I am still very much in beta testing. And if anybody wants complimentary access to beta tests and give me their feedback. My goal is that it will be helping you while you're beta testing. Because
Ooh.
so um, if we ask it like my, let's just say because we're now, of the age where we have 16 and over year olds. My 16-year-old is struggling with painful periods and heavy bleeding, but is feeling dismissed by her doctor.
So you've taught it to respond in a way that you normally would, correct?
I've taught it to respond in the way that I would, specifically citing and referencing peer reviewed, like specifically being clinically sound,
Okay.
and also it's pulling from how I think about things, how I talk about things, and also like from my book. So it's informed by a lot of like
Oh,
just me.
okay.
Um, and so I mean, normally it's not this not this long. This is why it's beta, right? So the goal is for you to kind of have like me in your pocket during this to get an idea of like now that I know what I know, what would I do? Like if I really did have a 16-year-old struggling with painful periods, what would I do? I don't know why it's taking so long. It normally doesn't take this long. Let's see.
I'm guessing because we're on a live
I
on
think
your
yeah,
Maybe that's storm outside.
and
it's like
it's storming and like all the things.
yeah, it's legit. Should have copied it. Okay, here we go.
Oh, there we go.
It was just glitched
Wow.
for a second. So it's taught to be like validating, but not like inappropriately or overly, but like first of all, like validating that you are not like your daughter's not abnormal because of this, that this is a problem. But it's also taught to be clinically sound in what it's saying. So research shows like it's going to tell you that it takes like if it is endometriosis, it can take 7 to 10 years. So let's not like let it take that long to rule that in or out, right?
Mhm.
Here's what could be happening. It's certainly not being a diagnostician and saying it is, but here's just some like words so that you can start to talk about this in your appointment. Here's some ways that you can start to document things to bring to your appointment. Specifically like how many, this quantifying, like we talked about with the abnormal uterine bleeding, like let's start quantifying as much as we can. I mean, obviously we're not measuring, but what are the other symptoms? What's the impact? Here's some, what I would absolutely must ask, what I would suggest you must ask, nice to ask if time allows, which, is always fun. And then here's some actual wording, that you could be using or and then it like and if you're continuing to be dismissed, here's some places where you can find guides who would be well versed in this and so all the things. There's always like an Avanti tip that would come kind of from like my book and my recommendations. So in any case, um,
I have
and then
chills. This is so great. This is
and then
so great.
this is the feedback. So you can do the feedback right in here. You don't even have to like send me a separate email or like, so this is intended to be convenient. So for anybody who's listening and wants to be part of the second, this will be my last beta round. It's totally complimentary. And I'm hoping that it helps you. Obviously, that's the goal. So just send me a DM or an email or find me somewhere. I'm sure you can find me in all the places.
Clay,
And
that's
it is
awesome. I
built.
remember you trying to get that up and running. So that's
Yeah.
awesome that you got
Yeah,
there.
I had to it's all built by me. There are no tech people involved, which is unfortunate for me, but I wanted it to be done right and I didn't have 50 grand to drop on it. So, I have built it and it is built also on a HIPAA compliant platform, so you don't have to worry about putting in obviously don't put in, too much information you don't need to put in. That was a pretty generic question. But in any case, so I wanted to have some solution at the end besides our talk. Obviously, we've all had a variety of details of our stories that were similar, some were different. But I think the point is, for those of you who know us, hopefully it brings it closer to home rather than just like, a social media influencer. Like we're real people walking around every day who are, relatively well versed in the healthcare system. We've all worked in healthcare at some point or continue working right now. And we're either gaslit or gaslit ourselves. So you're not alone. All of us are struggling with this. So we encourage you to ask more questions and to seek the help that you know you deserve. So any last words, Alicia and Liz?
No, just yeah, be in tune with your body and don't be afraid to bring up what is going on. And not to say everybody needs surgery. I was actually really nervous about having a surgery, but having unnecessary surgery is one thing, but having the appropriate options given to you so that you can make an informed decision with your healthcare team and with your own, your circle is really important.
Mhm. Yeah, I can chime in and say the same that Alicia did. Just don't settle for this is normal. That's not the case. My recommendation too would be, if you don't like the answers you're getting from your physician or you feel like you're not being heard, go to somebody else. Don't feel like you're stuck. I think another great thing to think about is if there's any medical evidence showing possible signs of whatever might be going on, take those and go to the next one. Keep as much of the information as you can, stockpiling, and bring it with you as opposed to just leaving breadcrumbs for someone else to figure out, because that'll definitely slow the progress.
Yes. Yes to all. And thank you all for, if you're on with us, staying a little late. Thank you both for staying a little late and for joining us in the conversation. So I'm hoping that this opens the door for you all to have more conversations, either with your friends or family, and of course, your physicians. Yeah, leave us any comments, send us any questions, and have a great night. Thank you, ladies.
Thank you.